slideshow presentation on atherosclerosis by myself, Ms. D.M. Stevenson, on behalf of DeVry University. The class is Pathopharmacology. BIOS 267 with Dr. Dottie K. Lingott. Atherosclerosis. This is a hardening and narrowing of the arteries. It can block your blood flow, put you at risk. Your arteries can get blocked. It's cardiovascular disease. It's the normal cause of heart attacks, strokes, and peripheral vascular diseases. Arteriosclerosis and atherosclerosis are sometimes used interchangeably, but they are different. Arteriosclerosis is your blood vessels, things that give you oxygen and nutrients to your heart. They get thick, stiff. This decreases the blood to your organs and tissues. Healthy arteries are flexible and elastic. The walls in your arteries can harden over time. Atherosclerosis is a specific type. It's a buildup of fats, cholesterols on the artery walls called plaques. These restrict blood flow. They can burst, cause blood clot. Atherosclerosis is considered a heart problem, although it can affect the arteries anywhere. It is preventable and treatable. Symptoms related to your coronary arteries would be arrhythmia, or dysarrhythmia rather, pain or pressure in your upper body, chest, arms, neck, jaw, your heart attack symptoms. This is called angina. Shortness of breath. A physician might find a weak, absent, or thready pulse. Decreased blood pressure in certain limbs, or they'll hear a bruit instead of a normal blood sound. Bruit. Yeah, I think that's how that's said. Symptoms related to the arteries in your brain. These are your stroke signs: numbness or weakness in your arms or legs, a hard time speaking or understanding someone who is speaking to you, drooping facial muscles, paralysis, severe headache, trouble seeing in one or both of your eyes. Atherosclerosis, risk factors and prevention. Risk factors are age, high blood pressure, high cholesterol, diabetes, obesity, smoking, family history, lack of exercise, and unhealthy diet. For prevention, they want you to quit smoking, eat healthy, make sure you're getting exercise 3 times a week, maintain a healthy weight. These are the same to treat as they are to prevent. It's censored. Diagnostic tests. The physician could order blood tests, check your cholesterol levels, Doppler ultrasounds, ankle brachial index, or the blood pressures in those different areas, electrocardiogram, ECG, stress tests like an echocardiogram, ultrasound or nuclear stress test, cardiac cath, angiogram, ultrasound, CT scan, magnetic resonance angiography, MRA. There are different medications, like the cholesterol medications that decrease the lousy LDL cholesterol, increase the happy HDL, the good cholesterols. This can stop, slow, or even reverse the deposits that are already lining the arteries. Your statins and fibrates, they can lower your cholesterol, stabilize the lining of the arteries in your heart. Antiplatelet medications like aspirin, beta blockers, angiotensin converting enzyme and ACE inhibitors, calcium channel blockers, water pills like your diuretics, your furosemide. Surgical procedures are reserved for really tough stuff. Coronary artery bypass graft, carotid artery surgery, atherectomy, the CABG, cabbage. It's not cabbage. Doesn't taste like it. It's bad. There's a picture for you. It's rough stuff. Percutaneous coronary intervention is where they're taking a balloon and putting it inside and blowing it up, trying to make a path. Prevention overview. Exercise at least 3 days a week. Physical activity can improve circulation and can help you develop new blood vessels. Exercise can help lower blood pressure. That reduces your risk for diabetes. It's good for stress. Diabetes is a risk factor. High blood pressure and high cholesterol, those are major risk factors for developing atherosclerosis. Reduce your stress. Don't stress over things like PowerPoints. They're frustrating, but it's okay. Don't smoke. It damages your arteries. Eat healthy foods. Maintain a healthy weight. This used to be considered a disease for elderly patients. Now we are seeing it in younger and younger. It's a sedentary lifestyle. It's, playing video games and eating junk. And Juvenile Idiopathic Arthritis Association, with early subclinical signs of atherosclerosis, dyslipidemia, hypertension, insulin sensitivity. This is caused by a physically inactive lifestyle, obesity, tobacco, smoking. Those all contribute. I don't think kids are smoking cigarettes as much, but they're still smoking and they're vaping, and we don't even know the risk factors of that. They could have a family disposition for cardiovascular diseases, dyslipidemia, hypertension, and diabetes. If mom and dad aren't eating so good and they're sedentary, chances are the children are too. This increases the kids' risk for cardiovascular diseases such as atherosclerosis. They need to get up, get moving, fueled with nutritious foods and water, not juice, healthy snacks. The most common rheumatic disorder in children is the juvenile idiopathic arthritis, and they believe this could be from prolonged immunological inflammatory processes, and that can lead to atherosclerosis too. These are the different stages: healthy, lumpy, healthy, bad. These images are brought to you by Bing Images, news medical articles from Pediatric Rheumatology Online Journal, Mayo Clinic, WebMD, Heart.org, brought to you by Misty Stevenson, DeVry University, Pathopharmacology, BIOS 267 with Dr. Dottie K. Thanka, and thank you very much. This was a hard thing to put together. Have a great night.